The thyroid is an extremely important organ and can be responsible for some major issues. So let's talk about it. I want to break it down, discuss some of the basics, and hopefully explain how it could be possible to have completely normal screening labs but still be hypothyroid as fuck! I am Dr. James Munro, and listen, nothing is more upsetting to me than seeing a patient who clearly feels terrible and they've been from doctor to doctor and everyone seems to tell them that everything is fine. It happens all the time. The truth is, the doctor just didn't find the problem and decided to stop looking. But everything is not fine. If you want to learn more about health and how to identify potential problems in yourself, make sure to subscribe to my channel. I'm going to continue making videos which hopefully help you to become your own health advocate. But today is thyroid day. The thyroid is this gland right here. It sits right above your tie knot and releases hormones that regulate body temperature and metabolism. If you're hyperthyroid, that means you have too much thyroid hormone and your hands are shaking and your heart's pounding and you're sweating and you can't sleep and you have anxiety, you're just amped up. If you're hypothyroid, that means you don't have enough thyroid hormone and you're cold, tired, depressed, constipated, memory, concentration issues, you're just kind of down. Both ends of the spectrum are uncomfortable and can even be life-threatening. But that's the thing, it's a spectrum. You're not either perfect or dying. There's a wide range of potential dysfunction that could be happening. This is why it's so important to look at the correct tests and interpret them appropriately. Let's start with the thyroid stimulating hormone, or TSH. This is usually the first and sometimes the only thyroid marker that is tested. This is the signal that comes from the brain and tells the thyroid to do its thing, to make its hormone. The brain senses the thyroid hormones that are circulating in the blood and it releases TSH as a response to that. If there's a lot of thyroid hormone in the blood, the TSH will be really low or even zero because your brain is not trying to stimulate the thyroid anymore. There's too much thyroid hormone. So if you're hyperthyroid, the TSH is really low because your brain is saying no more. And if there's not enough thyroid hormone in the bloodstream, then the brain will respond by making that TSH higher and higher because your brain is trying to tell your thyroid to make more thyroid hormone. So if you're hypothyroid, the TSH gets really high. But you can see that the TSH is not actually measuring the thyroid, it's measuring the brain, the pituitary gland. And the pituitary gland doesn't always get it right. So it is quite possible to have a totally normal TSH but have actual thyroid hormones that are not where they should be. Then we have T4 or thyroxine, and this is the hormone that the thyroid is actually making for the most part. It gets circulated around the bloodstream, but it doesn't actually do too much of anything until it's converted into T3. So again, you can have totally normal levels of T4 but still have hypothyroid symptoms. And this brings us to T3 or triiodothyronine. This is the thyroid magic sauce. T4 gets circulated throughout the bloodstream and then in the peripheral tissues, mostly in the liver, it gets converted into T3. And the T3 is responsible for most of the stuff that the thyroid does. T4 can also be converted into something called reverse T3, which is a completely inactive thyroid hormone. When it comes to labs, T4 and T3 are measured as either free or total, where free is the more active form of these hormones. Okay, let's review. We have the pituitary gland, which is sensing the thyroid hormone that's circulating through the bloodstream, and it's releasing TSH as a response. The higher the number for the TSH, the louder that signal is from the brain. So the higher we go, the more the brain is telling the thyroid to make stuff. Then the thyroid makes T4. And circulates that throughout the body. But it doesn't do too much of anything until it is converted into one of two things. Either T3, which is the really active stuff, or reverse T3, which is totally inactive. If you're feeling great and you go to the doctor just for a regular old checkup, looking at the TSH is a great option because it's just measuring the basic system. Make sure everything's kind of in check. But if you're symptomatic or there's reason to believe that there's something happening with your thyroid or your thyroid hormones, it's really important that you look at all of these numbers to get a good picture of what's happening. Something that I see all too often is people that are taking a thyroid medication called levothyroxine or Synthroid. And this is a medication version of T4. So you're just taking T4. And they have a normal TSH and a normal T4, and that's all that's measured. And the doctor says everything's fine, and they feel terrible. One thing that can be happening is that T4 is not appropriately converting into the T3. That's the active stuff, right? So if you're taking T4 and it's actually increasing reverse T3 and not the active T3, well, that could be why the medication's not working. So a person taking thyroid medication that doesn't feel well needs to measure all of their thyroid hormones because TSH and T4 doesn't tell us enough. Once we have a full picture of the thyroid and the thyroid hormones, we can pinpoint where the issue might be, and then we can start to work to find a solution. A really important starting point is nutrition. T4 is made of tyrosine and 4 iodine molecules, hence T4. And T3, of course, is tyrosine and 3 iodine molecules. So iodine is an extremely important nutrient here. And iodine in America happens to be a very common deficiency. In addition to that, zinc and selenium are extremely important in not only producing the thyroid hormone, but also converting the thyroid hormone appropriately. When we have someone that has a high level of reverse T3, that's a definite telltale sign of stress of some type. And that could be mental emotional stress, but it can also be physiological stress like starvation. In that type of situation, we need to identify and address any stressors that patient might be dealing with. Okay, so that's the basics of the thyroid, and there's a heck of a lot more to it than that. So if you have any questions, leave them in the comments below and we can talk about it, or I can even make a whole nother video about the subject. But the thing to remember is that if you're experiencing symptoms and you think something's going on with your thyroid and you've only looked at the TSH or the TSH and the T4, you haven't explored all of the options. If you appreciated this video, please click the thumbs up, and if there's a health topic you want me to talk about, leave it in the comments below and maybe I can make a video about it. I hope you're great, but I hope tomorrow is even better!